Welcome to McPlum, simple solutions served daily.
You start right away. Cleanse with lukewarm water and pat dry so the scrub can grip dead cells. Once done, do a small patch test behind your ear for 24 hours to rule out irritation. Apply roughly 1/2 teaspoon of Dr. Rashel De Tan'sin scrub to damp skin, spreading evenly. Avoid eyes and any broken skin. Use gentle circular motions for the first pass. Don't scrub hard. This product works by exfoliating chemically and physically, so light pressure preserves the skin barrier. Once the product is on, use your fingertips, never a rough cloth, and begin 30 to 60-second circular massages per area. You focus on tan zones such as the jawline, cheeks, and forehead, applying slightly longer attention where pigment is denser. The scrub contains active brighteners, therefore, massage gently to combine physical exfoliation with ingredient absorption. After massaging, rinse thoroughly with cool water to close pores and remove residue. Make sure to remove every trace, because leftover formula can cause sensitivity. Finish by patting skin dry and applying a non-comedogenic moisturizer, then broad-spectrum SPF 30 or higher. Sun protection is essential after exfoliation. Use the scrub 2 to 3 times weekly. If you experience redness or overexfoliation, cut frequency to once weekly until recovered. If stinging or a rash appears, stop immediately, rinse with cool water, and apply a cool compress. If symptoms persist beyond 48 hours or severe swelling develops,
Thanks for watching. Stay juicy and subscribe.